All right, let's get started with a question. What are the advantages of Southwest pain groups in office treatments versus going to a hospital for treatment?
Well, there's many ways you can receive pain treatment. The diagnostic and technical procedures we do, but there's some advantages for coming to our office because we can actually lower the cost. We can perform the procedures more economically, a lower copay to the patient. And we have the same facilities in our office as they're in hospitals.
Right. Well, I would imagine, you mentioned copay, and that's very important to people these days, that you do take most insurances, I would assume.
Yes.
Okay. Now, Stacy's with us from Dallas, and she's on the line. Stacy, what's your question today?
I've had chronic pain for over 5 years now, and I'm only 20. I've had so many people tell me that the pain is all in my head that I'm beginning to wonder, could it be me just imagining it?
I think that's such a great question because we've all known someone who said, people tell me it's just in my mind.
I wouldn't mind taking that one on because that's a kind of a topic near and dear to my heart. I have a lot of patients that are very young, and invariably, just like Stacy, they will come to us and say, no one believes me. And you look at young people, you think they can't have pain. People kind of discount pain in the younger population. Well, how can you be in chronic pain? She started at age 15, and in all likelihood has real pain. The problem is we're told we can't see it, we can't measure it, your studies look normal, you don't have it. When again, you got to get back to the point that pain is virtually unmeasurable. Now the things you can see with studies, a broken arm, a broken rib, you can see that, a torn muscle, you can measure that, you can MRI that. Some people have pain that's unmeasurable. Headache pain is an example of that. How do you measure a headache? People tell you they have a headache. So you can't, first of all, you got to believe the patient. You got to take them seriously. You got to give them a chance to tell you their story. And really, Mike, in my experience now, 16 years doing this, I find it extremely unusual that patients are making it up or that's in their head.
What I find interesting is when people talk about pain, sometimes it's very hard to relate to a doctor what I'm feeling. How do you guys deal with that?
Well, let me say that to you if you don't mind,
Sure.
Bob, because I want to tell you that's, and I'm hogging the show a little bit here, but I'll tell you, pain's hard to measure and it's hard to describe too.
Yeah.
That's the real conundrum. It's how do you describe to your doctor the pain? And you'll find that patients use different words to describe their pain entity. And we use that, it's helpful, but a lot of it's too, just the progression, how it's changed over time, how its onset. We can work with people and figure that out.